So hello and welcome you all to Sail to MDS Dental Academy. I am Dr. Malay Trivedi, Director of the Academy and Professor in College of Dental Sciences. So now dear friends, we are going to have the RPSC past paper discussion. So today we are going with the part 2. Part 1 we have discussed. So if anybody have not watched, you can go. The link is there in description box, as well as you can click on I button above. So let's start with the part 2. So here in part 2 they have asked about two questions. It's a classical radical neck dissection and modified radical neck dissection. So first question is about the classical radical neck dissection comprises which structure along with level 1 to 5 lymph nodes. So remember all three structure they comprise. There is an internal jugular vein, spinal accessory nerve, that is 11th cranial nerve, and sternocleidomastoid muscle. So here dear student, the correct answer is all of the above. Now what modified radical neck dissection type 2 preserves structure? So remember in type 2 they remove lymph nodes from level 1 to 5, the ipsilateral sternocleidomastoid muscle with preservation of two things, that is a internal jugular vein and spinal accessory nerve. So here the correct answer is option 1. Now what are the treatment modality for TMJ dislocation? So we have three modality. There's a Daughtry procedure, aminectomy, and botulinum toxin. So here the correct answer is all of the above. Now let's study all the three options a little bit. So the Daughtry procedure is a manual reduction technique to reposition dislocated TMJ. Aminectomy is the removal of part of articular eminence to prevent recurrent dislocation. And botulinum toxin we inject into the muscles around the TMJ to reduce muscle spasm and also help in management of TMJ disorder, including recurrent dislocation. Now another question, that is for extensive lesion involving more than 2/3 of the lip, which flap technique is the best option? So the correct answer is Karpenzig flap. So what it is, as friend, you can see in the diagram, it is a circular advancement type of flap that preserves the neurovascular supply, and it ensures that whatever the reconstructed lip retain its sensation and muscle function. Okay dear students, so remember this Karpenzig flap provide good functional as well as aesthetic result. Now pillocane, it's an amide type of local anesthetic, should not be used in the following condition. You should not use with the G6PD deficiency. Why? Because the pillocane can cause methemoglobinemia. It is a condition where hemoglobin is converted to methemoglobin, which cannot effectively release oxygen to tissue, and individuals with this deficiency are particularly susceptible to oxidative stress, which can increase the risk of methemoglobinemia. That's why it is a contraindicated in such patient. Now, which of the following components are absent in enamel organ? The correct answer here is dental sac. Let's see in detail. Remember dear students, the enamel organ comprises of four structures, that is outer enamel epithelium, inner enamel epithelium, stellate reticulum, and stratum intermedium. Mostly the enamel organ contribute to the formation of the enamel. What is dental sac? It is also known as dental follicle, but it is not a part of enamel organ. It will surround the enamel organ and help in forming the periodontium, which includes cementum, pedal, and alveolar bone. Now, which is the most common malignancy of the oral cavity? Here the correct answer is squamous cell carcinoma. It accounts around 90% of all oral malignancy. It commonly affects lip, tongue, floor of the mouth, and also other areas within the oral cavity. Now, what is the glossoplegia, dear student? It is a paralysis of tongue. Let's see other tongue in detail. What is a burning tongue? It is known as glossodynia or burning mouth syndrome. What happens in burning tongue? Okay, it is a burning sensation in the tongue which can be persistent, and sometimes they have no obvious cause. What is painful tongue referred at? It is referred as glossalgia or glossodynia. It can occur because of various reasons like trauma, infection, nutritional problem, or because of underlying systemic condition also. Bleeding tongue. Okay, this condition does not have a specific medical term but can be referred to as a glossohyria. Okay, it can result from trauma, infection, tumors, or any kind of the blood disorder. So dear students, that was all from the part 2. If anybody is interested to join our test series or a lecture series regarding the RPSC also with the past papers and all the important practice papers, you can contact me on the number given on the screen. So that was all from my side, dear student. Please keep on working. Very few days are left for the examination, And remember, don't just just do the past papers only. You have to keep on studying the synopses, some lectures, everything, to have the new questions and new ideas. So that was all from my side, dear students.